So let's talk about what this might mean for the American people. CBO, in a January analysis, said that repealing Obamacare without replacing it at the same time would result in 32 million more uninsured by 2026. Now, obviously, millions would be choosing not to have insurance, but also millions of them would lose Medicaid or would no longer be able to afford private insurance because of the stipends Obamacare asks. Now, offers. Your strategy is that there will be a plan for them, that the repeal will be delayed. But isn't that kind of gambling with other people's health? You're relying on, counting on the Senate to get its act together. What if it doesn't, and then all these people have nothing?
Yeah, so first of all, you're exactly right. We're talking about something different than what they're talking about, because I'm not talking about repeal only. Republicans need to stop pretending that everything worked well in American health care before 2009-10 when Obamacare was passed. And Democrats, frankly, need to stop pretending that Obamacare is working. When you're back here in rural Nebraska, I talked to farmer after farmer after farmer over the last week who are now paying between $20,000 and $30,000 a year in health expenditures because Obamacare's promise of reduced premiums, $2,500 per family, wasn't true. It raised them on average nationally in the individual insurance market more than $3,200. That's a $5,700 delta over what President Obama promised. CBO is filled with lots of well-meaning people, and they're good at certain kinds of analysis. But analyzing macro, long-term, highly complex, dynamic social programs, they've almost never been right. Remember, when they scored the equivalent of CBO in the mid-1960s, scored what Medicare would cost in its first decade, they were off by 1,100%. It cost 11 times as much in the first decade as they projected. Regularly, government scorekeepers underestimate costs and they overestimate coverage. We need to do better than Obamacare, and the Republican plan that I'm proposing, and again, I'm still willing to support a combined repeal and replace if our leader can get a good replace plan across the finish line in the next week when we come back from this work parade. But if not, we should unbundle them. Republicans gave their word they were going to repeal. We should do it. We should delay its implementation date, and all 100 senators should get before the American people on camera 18 hours a day for all of August, and we should do better than Obamacare. We can, we promised it, and the people deserve it.